There's nowhere that I would rather be today. Welcome to our office in uptown Scottsdale. I'm Dr. Douglas Cowan. We provide the finest in neurofeedback and counseling services, and we do hope that you learn from and enjoy this video.
Hi, I'm Dr. Doug Cowan. Welcome back to my office. Today's video, and really there'll be a series of videos over the next few weeks, we're going to be talking about the different types or the different styles of ADHD because it's important. And the reason why it's important is that as you can identify what particular type of ADHD your child or teenager, your spouse, yourself might have, you can then target the treatment program for that to be more efficient, more effective, just to work better, work faster. And as we're going to point out in today's video, we're going to talk about how these different types respond differently to different kinds of treatment. So it becomes very important for you to be able to identify what they are. I just cannot put them all into one video because it just takes too long to go over them all. So what we're going to do is I'm going to give you a good overview today, and then over the next couple of weeks, then the videos that you get will be about inattentive ADHD, impulsive hyperactive ADHD, ADHD with anxiety, ADHD with depression, and so on. So we're going to try to educate you there on that so that once you know what particular type of ADHD you are dealing with and what parts of the brain might be impacted by that, your treatment program can be very effective. So for example, before I go into great detail with you, some types of ADHD do not respond well to stimulant medication. Other types respond very well to it, in case that was a path that you wanted to choose. So you really have to know. So let's get started with the overview today, and then in the next couple of weeks, you'll also get videos on each different type so you can become more of an expert at it, and you can find out what kind of ADHD you're actually dealing with inside your home so you can help your doctor and your therapist to get the very, very best treatment for your child, your teenager, your spouse, or yourself. So here we go. So in general, let's talk about just two big categories of ADHD just to start with, and then we're going to move down into the five kind of true subcategories of ADHD. So just to conceptualize this difference, some with ADHD are too slow and some are too fast. Some are hypoactive, too slow. Some are hyperactive. And the slow moving kind. All right, so let's just kind of run through this really quick because this is kind of the direction that this is all going over the next 5 years, maybe 10 years. It's just to move ADHD into just two broad categories. And it's not bad for conceptualizing what's going on. So the hypoactive side, you get slow moving, lethargic, passive, often late. Hey, let's get out the door. We got to go to school. We got to get going. We got to get to this appointment. Just slow moving and often late. Sluggish thinking, can figure it out, but it's just going to take longer than the average bear to get it figured out. Can have problems with accuracy and details. Just not on it with details. People can talk about it as having brain fog, difficulty at concentrating, being easily confused. It's very common for people to say that. And frontal lobe things, we talked about working memories in another video. When we talk about executive functions, very, very important, the whole concept of executive functions. And part of that is what we call working memory. That's having a great concept of time. And that seems to be impaired with this hypoactive type of ADHD, that there's no real good concept of time involved. Often paying attention, but to the wrong thing, and not always sure what they're supposed to be paying attention to. They're usually not disruptive, usually socially really excellent, socially, like people, like to be with people. That's pretty common. And this is more common in girls than in males. All right, so it's not exclusive, but it's more common that way. So why is this important? Well, first, just to say that this sort of ADHD tends to not be oppositional or defiant. They have a medium to high risk for anxiety, medium to high risk for depression. We're going to talk about those specifically in just a few minutes. Medium to high risk for specific learning disabilities. And they don't respond well to stimulant medication. Only 20% in this category have a really good response to stimulant medication. 60% have a moderate response, but only 20% get that day or night difference. 60% kind of have a, hey, that's nice, that's good, it's okay kind of response. 20% have a poor response. So this category may actually respond better to non-stimulant medication, but they are good responders to talking therapy, to meeting with a counselor, talking things through, learning new strategies, trying new things, and so on. Then in this other general category, we have hyperactive ADHD, fast-moving, impulsive, lack inhibition, Tigger type, bouncy, can lack this self-control, this self-regulation. Again, we're going to talk about it in more detail, certainly over the next little bit in the video, and then also videos to come, because it's very important, very common. Impulsive thinking, a lot of guessing, aware of everything around him, maybe touching everything around him, which makes it very difficult in a store, especially if you have things that break around in the store. Can have like normal speed in thinking, but can be easily distracted and often can work too fast. And so they tend to guess at answers because it just saves time. Just guess, you might be right. Can be disorganized, can take hours to do that 20-minute homework assignment and then either lose it or fail to turn it in. Pretty common, really frustrating. Medium to high risk for being oppositional and defiant. Medium risk for anxiety, medium risk for depression can happen, but it's not as common as with that hypoactive type. Typically a family history with high rates of alcohol or drug problems. That's kind of interesting, just statistically, that's interesting. Their response to stimulant medication like Ritalin, Dexedrine, Adderall, 90% good, 10% moderate or poor. So for whatever reason, the brain of people who are hyperactive, Tigger types, and the brain of people who are hypoactive, more like Winnie the Pooh type, this type tends to respond to medication, stimulant medication, really good, really well. But they are poor responders to the counseling, social skills training, insight-oriented therapies, poor responders. So this is why we want to figure out what's going on, and we're willing to invest the next couple of videos for this. So let's talk a little bit more detail about the 5 different types of ADHD that I use in my practice and might be helpful to you. So for years in my practice with the families that I've worked with, 30 years of working with people, that I have used the story, the 100-Acre Wood story of Winnie the Pooh to help identify the different types of ADHD. So I identify 5 different types. Other neurologists, psychiatrists like Daniel Amen, he's got a book on the 6 different types of ADHD, and he's now identified 7 different types using SPEC scans. And when we talk about different types, what we're looking at is both different neurological profiles, as in different systems of the brain are impacted in different ways. And so you get different profiles in actually how people perform in the real world. And that's what we're always concerned with, is how do people perform in real life. So when I use the Winnie the Pooh characters, it's just a really simple way of kind of understanding what's going on. First is Winnie the Pooh himself. And Pooh Bear has the equivalent of inattentive, hypoactive ADHD. And look at how he's portrayed in the story. Look at how he's portrayed in the Disney movies. He's very gentle, he's very kind, and he's not particularly aware of any of the details. And sometimes his head is kind of in the clouds, but he's wonderful. And he is the perfect picture of this inattentive or hypoactive ADHD. Then we have Tigger, and Tigger is bouncy, and Tiggers bounce because that's what Tiggers do. And Tigger epitomizes the whole classic inattentive, impulsive, hyperactive type of ADHD that characterizes, when we think of attention deficit hyperactivity disorder, he is exactly what we think of. He's impulsive, he's bouncy, he's moving all the time, he runs into people, he knocks them over, he's touching stuff that he shouldn't be touching, and this is classic Tigger. And then we also have an over-focused type of ADHD. It's Rabbit. So Rabbit was the only character who would be ready for winter. Once Rabbit started getting everything ready for winter, for example, he didn't have the flexibility for you to just drop in on him at his house and have him stop what he was doing, entertain you, feed you, whatever. He would just be thinking about what he had to get done. He just had to do this. And a little bit different system of the brain that's involved. And as we look in more detail in a different video, we'll show you what that looks like. But this is the kind of person with ADHD who can be easily distracted, can be, inattentive. But once they get locked in on a task, they just simply do not have the neurological flexibility to move to the next task or to just stop for a minute, kind of multitask. They just can't. So once they're in it, you just let them do it until they're done. So Rabbit exemplifies this over-focused kind of ADHD without neurological flexibility very much. And then you have Piglet. And Piglet has anxiety. And there are a number of children, teenagers, adults with ADHD, legit ADHD, who also have symptoms of anxiety. And again, we'll show you the brain pictures of that. And so there's Piglet. He's worried, he's nervous, he's not very big, he needs support and attention. But he's worried and nervous. And so somewhere, maybe 20% of all people with ADHD also have these symptoms of anxiety. And it's because certain parts of the brain are just over-revved and other parts aren't revved up enough. So it's a system issue. What system is being affected? We have Piglet, anxiety. And then we have Eeyore. And Eeyore, remember Eeyore, thanks for noticing me, Eeyore's depressed. And there are another 20 to 25% of children, adults with ADHD who are also depressed. It tends to be the hypoactive type, but not exclusively. And so depression is a significant issue with those with ADHD. And again, it's certain brain systems are impacted by this thing we call ADHD. So some people are depressed. So there's the 5 of them. There's Winnie the Pooh, Tigger, Rabbit, Piglet, and Eeyore. And we're going to go into much more detail about each of those 5 in videos to follow. And then as you are able to identify what type of ADHD you're dealing with in your home, you will be able to target treatment for that particular type of ADHD because certain parts of the brain are impacted with that particular type of ADHD. Some types of ADHD respond really well to stimulant medications, some don't. Some require one kind of supplement, one another. And so once you know what you're working with, you can target your treatment program so it'll work much, much more effectively.